When we talk about a prolonged labor, what we're referring to is a labor that takes longer than what is considered typical for a vaginal delivery. Now, defining the exact amount of time that makes a labor prolonged, that can vary, and that's going to depend on the medical literature that you read. However, as a general rule, a labor that's lasting more than 20 hours for first-time mothers or more than 14 hours for women with subsequent pregnancies, that's oftentimes going to be considered a prolonged labor. But remember, these times can shift slightly depending on the source or the study that you're looking at. So it's important to keep that in mind when we're having this discussion about a prolonged labor. For first-time mothers, labor tends to take longer compared to women who have already given birth, and this is because the body is going through the birthing process for the first time, which can contribute to extended stages of labor. In subsequent pregnancies, though, labor can progress more quickly due to the fact that the body has went through this process before. However, even with this general knowledge, there's still going to be cases where a failure to progress happens, putting both mother and baby at risk. So what happens when labor fails to progress? This is where the risk of hypoxic ischemic encephalopathy or HIE comes into play. When labor stalls for too long, the baby can experience prolonged oxygen deprivation, leading to the potential brain injury, like I said earlier, HIE. The stress on both the baby and the mother increases as labor continues without progressing. And if medical professionals don't act quickly, serious complications can arise. In some cases, a prolonged labor is going to increase the risk of certain types of conditions like a uterine rupture or a placental abruption, which are dangerous for both the mother and a baby. The uterine rupture occurs when the uterus tears, often along the scar line from a previous C-section, though this is not always the case. Placental abruption can happen when the placenta separates from the uterine wall too early. Both of these conditions can lead to oxygen deprivation, raising the risk of the baby suffering an HIE brain injury. That's why it's critical for doctors and nurses to properly monitor both mother and baby during labor. They must make timely decisions to avoid complications that can lead to serious injuries like HIE. I'm Marcus Boston, and I'm a birth injury lawyer. If you have any questions about your baby's HIE brain injury at birth from a medical legal standpoint, don't hesitate to reach out and to contact me. All right, that's going to be it for today's quick educational video. Take care, everybody.